Every year, hundreds of women die during pregnancy or in the year after. For some, it's a result of pre-existing medical conditions.
But for most, it is preventable. 12 News' Kristen Pierce spoke with a woman now helping ensure that others get quality care.
Abnormal type of bleeding, hemorrhaging, cysts and fibroids and polyps and things like that.
Erica Wright has had reproductive challenges since she was a teenager.
A lot of doctors are telling you things will level out as you get older.
As an adult, she suffered through 2 miscarriages, the first one when she was 22 years old, the second at 28.
I keep having these episodes that are potentially life-threatening, are terrifying. I don't know what's happening.
The 40-year-old says she spent more than a decade asking questions and feeling unheard, even by a specialist.
Even in that appointment, he wasn't giving me eye contact. He was very dismissive, cutting me off in my sentences, very short. I felt like he was rushing me through it. I had to push pretty hard to get an ultrasound done.
And what doctors found was shocking.
It's like, oh, surprise, you have a massive amount of cysts that have been forming.
Erica had to be expedited for surgery. She says the cysts were precancerous but benign, and she has no idea how long they've been forming.
After pushing for the ultrasound and pushing to see a specialist, after knowing what they found out, is that something that you wanted to know years before?
Absolutely. I do wish that they would have taken me seriously all the other times. And has this now impacted my ability to have kids even more because we didn't catch this back then?
And you felt that disparity?
Oh, very much so.
The Centers for Disease Control and Prevention says Black women are 3 times more likely to die from a pregnancy-related cause than white women, and 80% of those deaths are preventable. Erica's experience is one of many. Dr. Anna Palatnik, an OBGYN maternal fetal medicine specialist at the Medical College of Wisconsin, says she has patients who have gone through something similar.
When your patients get to you, do they ever share experiences of feeling like their previous doctors weren't listening to them?
As a matter of fact, yes.
Why are you seeing those disparities?
It's a very good question. The answer is complex. Racial bias, inadequate access to health care, discrimination, some not feeling heard, not being heard, concerns not being addressed.
Dr. Palatnik is working to train the next generation of clinicians to address maternal health issues. She's also working on research projects focused on mental health services for pregnant patients and hoping to diversify the prenatal workforce.
Have you seen things get better?
Yes.
With that question, why did you hesitate?
So we still have ways and ways to go.
Her experience is why Erica is making it her mission to be a part of the change. Working at the Milwaukee Health Department since 2018, she's now one of 4 deputies in the department, overseeing projects like the doula program, the Women, Infants, and Children program, and the Community Health Care Access program.
As a Black woman from Milwaukee, as somebody that is pretty tenacious and unaccepting of the lack of quality and equitable care, this was definitely the place for me.
Erica never had children, but one of her biggest roles is serving women like her in the hopes of a better outcome.
What do you want for all women?
I want us to have the same quality access and delivery of services. I want it to be where they feel safe.
Experts advise people to advocate for themselves or to bring someone along to help advocate for them.
Dr. Palatnik also says high blood pressure can become very dangerous during pregnancy. She recommends people check their blood pressure at home, exercise, and have a low sodium diet.